Hello viewers, welcome from Narayana Multispeciality Hospital, Mysore. I am Dr. Mekhala. I am consultant radiation oncologist at NH Mysore, and we have with us Dr. Ravi ML. He is the senior consultant cardiothoracic surgeon as well as the clinical director here. Also we have Dr. Rajendra. He is the senior consultant interventional cardiologist at NH Mysore. With the World Heart Day being observed on the 29th of September, it's a great opportunity for us to talk about the digital health transformation, which seems to be the way forward in management of heart diseases, as well as some other concerns around heart diseases. So, to start off, Dr. Ravi, could you please tell us the theme of the World Heart Day 2021? As well as the message for this year.
Uh, Thanks so much, Dr. Mekhala and Dr. Rajendra, for this program. Um, every year we celebrate the World Heart Day. So, what is new this year? It's probably, other than the theme, it's the mind-boggling numbers, the statistics which make the World Heart Day significant every year. 2019-20, we lost more than 18 million people to heart attacks and other heart diseases and strokes. And if you look at the US statistics, every 35 seconds there's a death due to heart attack or stroke. So these numbers definitely warrant a discussion every year to promote awareness about heart disease. So every year, it's an opportunity to create awareness, bring about a change in the people's behavior, make them more focused on the risk factors and how they can approach those risk factors with appropriate changes in themselves so that they can cut down the risk of heart attacks and strokes. And having said that, the theme, of course, this year is very interesting. It's digital health, and which means harnessing the power of digital health to bring about this awareness about heart health and what are the steps that we can take, how we can monitor our own health both at the individual level, and how the digital transformation, as you rightly said, helps healthcare providers to take appropriate steps to better manage heart disease and stroke is the theme for this year. So it's indeed, and as you know, just yesterday, the Indian Prime Minister Modi declared the digital health mission, wherein every individual will have a unique health ID through which we can access the entire medical history of the individual. So no need to carry papers and no need to carry files every time the patient visits the hospital. So that is the power of digital health that we are talking about, Dr. Mekhala.
Okay, it sounds very interesting. Dr. Rajendra, could you tell us what are the risk factors that surround heart attacks and strokes?
Well, there are traditional risk factors and there are some new risk factors. Like Dr. Ravi was saying, digital health is the new sort of mantra because everything is digital nowadays. Previously, you had to go to a bank. Now you have everything at your fingertips, not just bank. So your money, your transactions, your identity, everything is in digits. So it's all binary. And so I think it is time every other sort of industry or every other facet of life has been taken over by the digital sort of infrastructure, and it is about time that health also gets into the whole stream. So digital health is a great push. Everybody has a mobile phone, everybody has a phone that can be used for everything else, so why not this? Coming to the risk factors, I think yes, there are certain risk factors you can modify. There are certain risk factors you cannot modify. So if you look at the non-modifiable risks, then it's what we are born with, our genes. Certainly nothing you can do to change that. Your sex, if you're a male, you're at higher risk of heart attacks. Having said that, there's a huge sort of disease burden in women also, and there's a big push about diagnosing and managing heart disease in women as well, which has sort of been underdiagnosed of late. And also your age. We know that cardiovascular disease, heart attack, strokes, heart failure has a preponderance with increasing age. Having said that, again, there is a discrepancy here. We are seeing much younger people come in with heart attacks and strokes. So this is something we need to look at. Of course, there are modifiable risk factors. The major one is the lifestyle. People are not exercising as much as they should. They're eating what they shouldn't. So the lifestyle is a huge risk factor, and we'll go into that as we go through the discussion. And of course, diseases like high cholesterol, diabetes, blood pressure, high blood pressure, and smoking. These are all risk factors that one needs to look at in terms of heart and heart-related diseases.
Okay. Dr. Ravi, you were talking about the digital health transformation. Could you tell us something more? How would this digital health impact the patient at the level of the patient? Would it bring any changes there? Also, does it change the healthcare system in any way?
Definitely, as the term indicates, it's bringing about information, the health information and the technology together. So it's something like a big data analysis, if you want to call it that way. So the digital health encompasses about 4 or 5 main streams. One is, of course, the smartphone. Any phone that is ready with the apps, the so-called smartphone is a major device where you can monitor the and transmit the ECG, or a real-time blood pressure monitoring can be transmitted, and blood sugar levels can be transmitted. So this acts like a major device. Then, of course, we have the wearable devices like the smartwatch. Smartwatch, of course, is indeed a major player, I would think, in the coming days, because the person who is wearing that can monitor his daily activity, the physical activity, the steps that he has been taking, the calories consumed, the heart rate, the blood pressure, saturation, you name it, you have it. So the possibilities are endless, limitless. And then you have the telemetry, the telemedicine, where you can access data and speak with patients from any remote corner of the world and help them, pick things up early and diagnose and treat. And then, of course, the health information itself is a major tool which helps in bringing all these things together. So, if you look at the individual level, this is how it helps. The long-term diabetics, for instance, after a few years, it becomes difficult to control their sugars. So then now there are small chips which, when transplanted under the skin in the arm, it gives a real-time interstitial sugar monitoring. So it picks up much earlier a hypoglycemic attack where the sugars are very low, or it picks up a very high sugar as a real-time alert before the patient gets into acidosis or ketoacidosis. So these patients can be monitored, quickly help them reach take first aid or wherever they are, and then reach appropriate center for better management and then control things. So that is at the individual level. If you look at the society or the healthcare provider level, for example, we can talk about the big data analysis and the electronic medical records and electronic health records, for example. So that's what the Prime Minister has projected yesterday, where at the press of a button, you have the entire medical history of the patient available at the fingertips, either on a smartphone or similar device. So wherever the patient is, he does not have to carry the paper record. So whether he is in Kashmir or whether he is in Kanyakumari, and wherever the patient belongs to, if he has a problem there, the local healthcare provider can access his data and do whatever is required to save his life. And then, of course, the information analysis, big data analysis goes a big way in prediction and prevention rather than diagnosis and cure. For example, you can say which area there is a higher, preponderance of, for example, some kind of a cancer, or where you are getting more of some transmissible infection. So that way we can take steps to prevent that, and then you can get the healthcare ready with appropriate staffing. For example, say in the emergency room, if there's a critical alert which comes along, which says, there is a problem happening there, and you might be receiving 100 patients in the next 1 hour. So then the healthcare facility is ready to receive them and do the needful. So, the implications for this digital health and transformation are huge, endless, and it's a fantastic area to probe and adapt in future.
Okay, thank you so much.
If I may just add in, sir, you very lucidly said, I was just looking for actually a communication. A patient is in his 90s, has just flown to America. He's been under follow-up. So, and the power of telemedicine is such that the patient can still be in touch with his cardiologist. I've been looking after his heart rate, his blood pressure, his weight, everything. So it is at the tip of a button. So this was unimaginable even 2 decades ago. So I think digital health is there and it is the future, and we need to embrace it sooner than later so that we can adapt. And like Dr. Ravi says, it not just one facet, it is multifaceted. And particularly with regards to the heart, I think we are dealing with 3 things, sir. One is the heart failure, which has a very high mortality. Patients die very quickly with heart failure once diagnosed. The prognosis is worse than cancers. Number 2 is heart attacks, and number 3 is arrhythmias. I think what we are sort of seeing is just the tip of the iceberg. I think it is limitless, and the more we sort of delve into this, the more we'll sort of see how we adapt and how it sort of manifests itself. So we'll sort of have, you were asking now.
So if I may add one more, we realized the power of this digital health much before this theme was announced, and even the Prime Minister declared the digital transmission. During the peak of COVID-19 pandemic, both first and second waves, if you can recall, there were at least 50% preventable cardiac deaths happening outside of the hospital, in the village, in the home, because there were lockdowns, there was no transport available, and hospitals and healthcare facilities also discouraged them from reaching the hospital for certain chronic issues, and thereby the patients stopped coming to the hospital even for an ailment like that, a heart attack. So that many more deaths happening there. At the same time, what is heartening also is to note that your elderly rural populace during the COVID pandemic peaks, they connected with you online,
Correct.
both for audio and visual consultations. They took online appointments. They passed on their earlier medical reports and the treatment reports to us.
Yeah.
We checked them, we told them what to do, what not to do, and then thereby though they did not reach the hospital, they could take care of themselves for certain issues.
Absolutely.
And the other, the point is also that that much of a reduction in the loss of working days for them. One elderly patient with 2 of his attendants coming from a remote village like Chamarajanagar to Mysore, and then all the attendant costs.
It's a full day gone.
Full day gone. 3 working days lost.
Correct.
So the advantages are huge.
Absolutely. So I think we are looking at the sort of the good side of digital health. I think at the same time, sir, I think we need to discuss. This is unprecedented. The data that is coming in, the amount of sort of information that we have, I think it's sort of we don't know where exactly we're going. So if I may add, sir, isn't it the right time to also discuss, yes, we need to encourage patients to going with digital health. The organization needs to be geared up for digital health, but also the information that's coming in. I think there is a huge responsibility with regards to data protection also. And I think personally there's sort of more research that's required into how we store this data, how it is accessible, what are the pros and cons of, data protection is taken very seriously all over the world. I think we need to have mechanisms also to put a check so that it is not sort of used indiscriminately.
Patient privacy and cyber security definitely has to chip in to make this a successful mission. Absolutely.
I think if I may add, time seems to be the most important factor in preventing deaths from any cardiac disease.
Absolutely.
So I think that's where the digital health transformation is.
Absolutely.
It is an advantage in saving a lot of lives.
To give you a very easy example, madam, 10 years or 15 years ago, sort of Dr. Ravi and I have worked in the Western countries. Even there, when a patient had to come with a heart attack, they had to present to the emergency department, and then the clock would start. Now it is not that. Like Dr. Ravi said, if an ECG has been taken in Chamrajnagar, if it comes to me immediately, the time starts then. So, the concept of heart attack presenting to an emergency department, the clock starting from then, and then from there, the current parameters to measure that are door to balloon. Now it is an ECG to balloon, or a referral to balloon, or a WhatsApp to balloon. That's where we're heading, and it's very heartening to see. We have started a program from Narayana, wherein we have a Kodagu, which is a very sort of hilly area cut off from mainland, not many accessible healthcare there. So we've started a program wherein we called it Kodagu Mitra, MITRA, myocardial infarction, timely revascularization. Immediately, a patient presenting with an ECG, the ECG gets sent to us, and then I have a look at it, heart attack, he needs to come to the cath lab. Even if it is 11 o'clock in the night, or 3 o'clock in the morning, or 10 o'clock in the morning, it doesn't matter. The clock starts ticking, and then there is a protocol, sort of a streamline wherein the patient will come. The ECG is there, and now all the other, like Dr. Ravi says, whether they have an insurance card, a BPL card, or whatever, that gets transmitted with the digital health mission, that gets looked into, their eligibility, etc. So by the time the patient makes the travel to Mysore, to the NH cath lab, everything is ready, they just get wheeled in. So time is muzzle. So now digital information is very crucial. So we take them to the cath lab and do revascularization, angioplasty is done. Time saved, life saved. All because of the digital information.
That is an excellent point that you raised and very explained in detail. This is a happening thing. It is practical. It is happening. You get a smart case ready ECG device, just 3 inches long, which is kept against the arm or the thigh of the patient presenting with some chest pain at a remote primary health center, wherever. And then the ASHA care worker or the junior staff nurse can pick up that ECG recording in her app-ready smartphone, pass on the information to a physician like Dr. Rajendra in a specialty hospital, or to the ICU, or the local physician even. And then on their advice, give the required local aid, maybe aspirin, maybe clopidogrel there. And then the same message informed to the ambulance driver to keep the ambulance ready. It reaches there in no time. Patient is picked up and lands up in the cath lab ready hospital like Narayana, where the patient in the next 15-20 minutes, half an hour, patient has had a stent put in, life saved. This is happening. So that is the power of this digital transformation.
Yes, sir. I think we need to take it forward. We need to have more networks. We need to sort of look at it and evaluate it, audit it, research into it. And this, I think, rolled out to the whole sort of country will help save millions of lives over a period of time. There's no doubt about it.
And we don't need to doubt about the capability, because the smartphone penetration in India has been more than 54% in the last during the few years, and you will be surprised. The smartphone usage for internet in both the rural and urban is upwards of 90%, 92 to 94%, even rural.
Fantastic.
And daily internet usage. So we are ready.
Yeah, you just need a proper direction and sort of information out there. So that it's interesting. My dad, who's 77, day before yesterday, told me how his sleep pattern is, because he wears a smartwatch. So he keeps a track of his steps, what he does, and these things are getting so much more refined. They tell you how you sleep. And we had one sort of in the peak COVID, when people were sort of scared and coming to hospital. I had one phone call in the evening about 4:30. So one of our patients, I've been following him up for 3 years. He's been absolutely stable. He had some sort of a function at home. He was sitting and he started feeling a bit sweaty. So he called me. I said, well, can you go and get an ECG done anywhere locally? He was in one of his farmhouses. So I said, no, Rajendra, I've got a smartwatch and it's showing 148 heart rate. So that clearly is a sort of a thing that needs to be followed up. So I said, okay, fine. Don't worry, we'll come. We made a decision for him to come straight away. We looked at his smartwatch algorithms, and his heart rate had spiked from 70 to 148 in the last 1 hour. So he was having a heart attack. So we immediately stabilized, did an angiogram the next day. Turned out that he needed a bypass, which happened 2 days later. So life saved because of this smart technology. You must remember him, Doctor. Yeah.
Yes, definitely. He's doing very well. Thank you. The other gentleman also, if you can remember, the gentleman who lives in Germany.
Yes.
He had some chest pain there. He had some preliminary checkup there. Then he passed on the information to us. Next morning, he
was
landed
here.
here in Mysore. And then you did an angiogram on him, showed critical disease. He had a bypass too. And 6 months down the line, he was running marathons back in Germany.
Marathons after marathons.
Marathon after marathon. He even showed us the picture of the medals that he has done. So it's indeed a splendid.
And like you said, the rural sort of coverage, the rural penetration of this of this internet usage, if we just give it a proper direction, then the amount of resources required for people to come to hospital is not required, and things can be managed more. Of course, the physical sort of presence, the touch, yes, it is there, but especially in emergencies, I think we can make a quick decision and a proper sort of care pathway.
This is the importance of digital health. Connecting the points, connecting the patients and the consumers on one side, the healthcare facilities, the providers, the physicians and doctors, and the referring team. So this is what digital health brings about. Bringing things together, connecting all these points and making things happen and move forward.
Does it also in some way prevent the false alarms that could be raised due to misdiagnosis or inadequate infrastructure for diagnosis?
You want to answer that?
Yeah, I think yes, there is scope for refining every sort of processes here. Now, what is important is, like Dr. Ravi says, the EMR. It can be a foolproof method of recording, monitoring, and following up patients' care. So yes, everything is recorded. There is no way that somebody can go and sort of erase it. That is minimal. So the errors sort of get more and more looked at, and this also brings about a improvement in patients' quality of care, and also especially if you're looking at in a Western sort of situation, it would sort of, I think, reduce the litigation, the medical negligence, etc., etc. What happens? I think with the digital health, we can sort of move towards the right direction. And you're absolutely right. If something is not required to be escalated, it can be stopped there, and the patient can be reassured. At the same time, yes, if it is required, it can lead to a life-saving procedure.
Would you like to say something about PCI, primary?
Yeah, primary angioplasty is the standard sort of treatment for heart attacks, big heart attacks, what we call ST elevation MIs. We know that these are the biggest killers in the all over the world, and Mysore has about probably 15 cath labs, quite a lot of hospitals. Despite that, we are not able to cater to the amount of people. You still see obituaries coming down saying that this patient died of a heart attack, and I think every heart attack death is preventable, at least attempt. But the problem is patients have to present at the right time to the right place. The 24/7 primary angioplasty, which we've been running here for the last 7 years, is doing an amazing, tremendous amount of work. Very, very proud of it. We have a cath lab that is open 24/7. Anybody with a heart attack, they get the standard world-class treatment. This saves lives. For us to be able to do primary angioplasty, the diagnostic tool still is an ECG. So an ECG done 60 kilometers away can still be transmitted within a minute, downloaded, and the right direction given, so that they don't have to waste time. Time is muscle, time is everything in this. So the earlier the patient presents, like we said earlier, the better. So digital sort of health, the routes for the transmission of the ECG, for it to reach from the patient or the general physician to the cardiologist, has become minimalistic now. The time, so decision can be taken. Primary angioplasties can be done. The earlier the better. So the golden hour, the first 6 hours is very, very important, because patients presenting late have a higher sort of complication rate. So they present early, they have the procedure, the likelihood is that they will have a successful treatment and they will get back to normalcy is very high. Again, young people are getting more and more heart attacks, and we want to emphasize that Chest pains need not be taken very lightly. They should be taken seriously. At the minimum, an ECG can rule out a heart attack. And from there on, the patient sort of can have an eventful recovery.
With the pandemic still around us, would you like to share your experience of treating heart patients?
Yes, I think we have had nobody was ready for COVID. COVID happened, and we sort of picking up the pieces as we go along. Now, COVID affects the heart in a multiple sort of ways because the primary effect of the COVID virus is on the blood vessels. So the heart is a big, huge blood vessel that keeps pumping. It pumps to itself. There are also it pumps into the lungs. So a lot of complications happen. Heart is affected in various different ways, from the lungs to the heart, and also the small blood vessels. We've seen a lot of complications, a lot of morbidity, and we have learned as the pandemic has progressed. And again, like Dr. Ravi said, it is here wherein the digital sort of health has come on a long way, because monitoring of the patients, the oxygen levels, the heart rates, we can predict with artificial intelligence has come in. There are a lot of algorithms that are going in with regards to predicting who has a worse outcome than others. So from regards to that, we have had a lot of patients presenting with heart attacks who also had COVID. Now, heart attack is an emergency situation. COVID is a serious condition. We cannot bifurcate the two. So yes, anybody coming with a heart attack gets the treatment. If they are COVID positive, they get the treatment for that also. We've seen that patients who came with heart attacks with COVID had a much higher clot load. Their blood was much thicker and stickier. So there was some difficulties in treating it. But I think as the time has progressed, we are sort of getting there in terms of treating them to the hilt.
So if there's anything else you would like to add to this?
Well, if we have to convey a message in the background of digital health and World Heart Day, I think some of the healthcare challenges that we face every day are, as you actually raised the topic earlier, the preventable medical errors. From dosing errors to indenting errors and look-alike, sound-alike medications and so on and so forth. And the high costs of medical care, then adjusting to the changing clinical trials, adopting new guidelines as to what the new results are showing, whether it's heart or cancer or any other treatment. And of course, the other issue and challenge is the inequitable distribution of healthcare across society strata and across different levels. So when we bring a change in digital health and digital transformation, I think some of these issues can be answered better and treated upon better. For example, the big data analysis would help us in better risk stratification and management. It will definitely help us in better identifying the issues in supply chain management, what medicines we need, what are the other health care accessories that we need, how much we need. And for example, if you look at the COVID scenario, there was no real-time data on the bed availability. So when people needed oxygen, they were running here to find out where they can access a bed and get treated. So all these things would be answered to a certain extent, I would definitely think. So these are all and of course the change that comes about in a patient's behavior when he knows that he has control over his health by using the smart technology, wherein he's also a decision maker in his health. That is, of course, a wonderful bottom line to all this. Patient involvement and his adaptability to better monitor his health. So these are some of the very positive changes, I think, which can go a long way in improving the health of our society.
To wind up the whole thing in a nutshell?
Yes, I think digital health is here to stay, and I think there are certain roadblocks to sort of adapting to this. we as healthcare providers, if we are sort of ready and ready to accept the whole thing and provided in a proper guideline mediated way, then we can pass the benefits on to the patient. There is nothing more that would make me happy than to see a patient without walking in, and I know what his or her history is, what their medical background has been, what needs to be done, and how to sort of put it all at the fingertips, really. So everything is at your fingertips now. I think we have to embrace this. So digital health is the way to go forward. We need to find out ways to do it successfully and safely.
Okay, I think with this we come to the end of this session. I thank you both for your valuable time and information, and I hope it has benefited everybody who has viewed the program. Thank you so much.
Thank you.
Thank you.